So with students returning to schools, COVID-19 is seeing another surge. The CDC estimates 32 states are seeing a spike. Just as classrooms are opening up this month, the World Health Organization released a new report. It highlights the viruses and bacteria that could be a threat. KXAN's senior science reporter Eric Henriksen takes a closer look at the viruses on the list.
Ahead of the COVID-19 pandemic, two small SARS outbreaks got researchers ready. 2002 in China and 2012 in Saudi Arabia.
So you had two spillover events into the human population 10 years apart, and we thought, well, that's likely not the end of it.
Researchers like Jason McClellan with the University of Texas got to work, studying the virus family years before COVID hit.
And that's one of the reasons we were able to roll out vaccines so quickly.
Similar forethought is top of mind with the World Health Organization's latest report, the R&D Blueprint for Epidemics.
There's a finite amount of resources, and so we have to try to prioritize research on those families of viruses most likely to cause the next pandemic, while also still realizing that we could be surprised by a low probability event.
Last released in 2018, this report highlights dangerous virus families and bacteria.
Some viruses and some viral families may have a low probability of spilling over into the human population, but if they do, they might cause a pandemic.
The report includes viruses like the coronavirus and influenza, but also things like smallpox. The report doesn't focus on individual strains like COVID-19, but instead families of viruses. However, it does direct researchers towards prototype pathogens.
Those are viruses that we think are pretty representative of that viral family.
Now, research done on this one prototype pathogen can then be applied to all viruses in the family. Other families on the list include things like monkeypox, the Nipah virus, and dengue fever. McClellan, who contributed to the report, says the list will serve as an excellent guide for researchers.
These are all viruses that the scientific community is aware of and has studied. There's no new pathogen that has surprised us.
Eric Henriksen, KXAN News.